Hey everyone, let's talk about something called human metapneumovirus, or HMPV for short. It's a common bug, kind of like the flu, that can make you cough and sneeze. Scientists discovered it back in 2001. Just like the flu or RSV, this HMPV bug likes to hang out in your lungs and airways, which are the paths for air in your body. This can make it hard to breathe sometimes. HMPV is everywhere in the world and usually causes trouble during the winter and spring. While anyone can catch it, little kids, older folks, and people with weaker bodies need to be extra careful. They might get sicker than others if they catch this bug. So, how can you tell if you have HMPV? Recognizing the symptoms early can help in managing the illness better. Well, it looks a lot like other colds and coughs. The symptoms can be quite similar, making it tricky to distinguish at first. You might feel a little under the weather or really sick. Fatigue is common, and you may find yourself needing more rest than usual. The most common sign is a cough, which can be dry or sound like you're coughing up gunk. This persistent cough can be quite bothersome. You might also have a fever, a runny nose, and general discomfort. These symptoms can make you feel quite miserable, and a stuffy nose, like you have a cold. This congestion can make it hard to breathe through your nose. Some people even feel a bit winded, especially after physical activity. This shortness of breath can be alarming. Make a wheezing sound when they breathe, which is a high-pitched whistling sound. This can be a sign of airway obstruction, or find it hard to catch their breath. This difficulty in breathing can be quite distressing and may require medical attention. For babies and toddlers, HMPV can sometimes be a bit more serious. Their smaller airways can get blocked more easily. It can make the tiny airways in their lungs swell up, making it hard for them to breathe. This is called bronchiolitis. It's important to monitor their breathing closely. It can also lead to pneumonia, which is an infection in the lungs. Pneumonia can be severe and may require hospitalization for proper treatment. Right now, China is seeing a lot of HMPV cases, especially in young children. Hospitals are packed with kids who are having trouble breathing. Doctors have found that many of these kids have HMPV. We don't know exactly why there are so many cases in China right now. Maybe it's because people are getting together more often since the COVID-19 restrictions were relaxed. Maybe it's the start of the cold season. Whatever the reason, the Chinese government is keeping a close eye on things. They're doing more tests, keeping sick people away from others, and telling everyone about HMPV so they can stay healthy. So how can we stop HMPV from spreading? It's a question many parents and caregivers are asking, especially during the colder months when viruses tend to spread more easily. It's all about keeping clean and healthy, just like how we try to avoid other colds and coughs. Regular cleaning of frequently touched surfaces like doorknobs and light switches can make a big difference. The best way to keep those germs away is by washing our hands. This simple act can prevent a multitude of illnesses, including HMPV. Use soap and water and scrub for at least 20 seconds. Make sure to get between your fingers and under your nails where germs like to hide. Do this lots of times, especially after you cough or sneeze, before eating, and after touching your face. These are critical moments when germs can easily spread. And of course, after using the bathroom. It's a habit that should be ingrained in everyone, young and old. If you can't find soap and water, use hand sanitizer. Make sure it contains at least 60% alcohol to be effective. Another thing you can do is to cover your mouth and nose when you cough or sneeze. This helps to prevent the spread of droplets that can carry the virus. Use a tissue or your elbow to trap those germs. This is especially important in public places where others can be easily infected. Throw used tissues away right away and wash your hands well. Don't let those germs linger around. And try not to get too close to people who are sick. Maintaining a safe distance can help you avoid catching the virus. Now, here's the thing about HMPV. There's no special medicine to make it go away completely. This virus, known as human metapneumovirus, is something that our bodies usually have to fight off on their own. But don't worry, most of the time it goes away on its own in a week or two. During this period, it's important to get plenty of rest and stay hydrated. Drinking lots of fluids can help your body fight off the infection more effectively. You can take some medicine to feel better, like the kind you take for a headache or fever. Over-the-counter medications can help alleviate symptoms such as fever, aches, and congestion, making you more comfortable as you recover. But always ask a doctor before giving any medicine to children, especially babies. Young children and infants have different needs and sensitivities, so it's crucial to get professional advice to ensure their safety. Sometimes, little ones might need to go to the hospital if their HMPV is really bad. Severe cases can lead to complications like difficulty breathing or dehydration, which require medical intervention. At the hospital, doctors can give them oxygen to help them breathe, clear their airways, and make sure they drink enough fluids. Medical professionals are equipped to provide the necessary care to help your child recover safely. The good news is that most people who get HMPV get better just fine. With proper care and attention, the majority of children and adults recover without any long-term effects. But it's always best to check with a doctor if you or your child feel really sick or have trouble breathing. Early consultation can help manage symptoms more effectively and prevent complications. If you found this information helpful, please subscribe to our channel, like this video, and leave a comment below. Your support helps us create more content to keep you informed and healthy.